Now, World Food Day, observed on the 16th of October each year, highlights the plight of 870 million undernourished people in the world. Most live in rural areas where their main source of income is agriculture. Now, according to the UN, from September to December 2020, 9.34 million people in South Africa, which is 16% of the population analysed, faced high levels of acute food insecurity. The food basket for the average South African costs around 4,000 rand, while only 60% of South Africans earn the national minimum wage of 3,321. How does the country reach a better food security ecosystem? To answer that question, we speak to the Associate Professor of Economics at Stellenbosch University, Professor Dieter Von Fintel. Very good morning to you, Professor. Thank you so much for your time. The reality of hunger, I suppose, has been exacerbated now more than ever before because of the impact of COVID-19. But we do know that food insecurity in South Africa is not something new.
Yes, that's quite correct. We have a long history of very hungry populations. At least since the start of the 2000s, cash transfers, particularly the child support grant, has helped a lot to reduce hunger. But as soon as crisis strikes, such as the 2008 financial crisis and particularly COVID-19, we see hunger rates spiking quite substantially. So, for instance, the child hunger rate, if you look at the Newzroom data, almost doubled to close to 15% in South Africa. 15% of households that have children experience hunger, which is quite a severe figure if you think of our level of economic development, if you think of basically the support that children also experience in schools, that this is a really severe situation, thinking about how widespread hunger actually is in a country like South Africa. And the situation is, of course, much worse in the rest of Southern Africa, where a lot of households still depend on smallholder farming and where climate change has become a serious issue, and that really threatens household sustainability and household resilience to actually achieve the kind of foods that children need and that also that adults need. And I guess it's not also just about having enough food on the table. I think the more serious and the more long-run issue is having the right food on the table. And the region also really struggles with acute malnutrition, where children are not tall enough for according to the international benchmarks of the World Health Organization. So, our stunting rates are close to 1 in 3, which is also very severe in comparison to where we should be given our economic development.
As you speak to those factors, Professor, it's really clear that what we have here is not a short-term crisis solved by charitable food distribution. The problem is much more significant.
Yes, that's right. If you see the run-up to the COVID crisis, you would remember particularly the cyclone Idai that took place earlier in the year. We all recall the day zero in South Africa, which obviously has a climate problem. So what you see is really the escalation of vulnerability, particularly in rural areas where households often do depend on growing their own crops. And this problem isn't becoming smaller, it's actually growing bigger. So if you think of a country like Zimbabwe and Mozambique, where these climate crises you've had in some senses a double climate crisis, both droughts and floods, which really exacerbate the situation. If we think that climate change doesn't have a solution, it's not certain that we're moving in the right direction in this regard. But if we take an even longer run perspective, we know that malnutrition among children has been a problem in South Africa for decades, particularly if we think about South Africa, and that the high rates of malnutrition the needle has barely shifted in the last 40 years, for which there is good evidence. We're currently looking at more evidence back in history, and it shows that the problem has been here for a very, very long time. And despite the economies growing, it's just the fact that it's not that there's not enough food, it's just sometimes how the food gets to people. So if you think of inclusive economic growth, if economic growth was truly inclusive and there was a far more equal society, we would see that access to good food would be available to far more people. If you think of the current situation, the most recent agricultural season was a very good one in South Africa, but it was also the same season when hunger was on the sharp rise because of the COVID-19 crisis. So there's a multitude of factors. It's really not just the fact that we don't have the food to feed people. It's also about how the foods reach people and whether the right foods reach people, so that children are able to grow. And I think inequality is a big factor in determining who has access to the right foods and who is able to consume the right diets, and whether children and also adults actually have enough food on the table. So, and I think because of our long history of inequality within South Africa and Southern Africa more broadly, it always means that just even if you've got enough food in the country, that there are always large groups of people who remain excluded.
As you speak about having the right food on the table, I think you speak to a really important point here, as overall you are highlighting the systemic problem that is one to note, especially as it points to all the loopholes in the country's food system. What is it that would help us reach a better food security ecosystem as you make some of those really important factors?
Yes, so I think the other factor which is also very important to note is the high levels of urbanization in Southern Africa. And this is a trend which will also continue, which means that as individuals migrate to urban areas, they migrate into a different part of the food system. Where traditionally households consume foods that they cultivated themselves, they are now far more exposed to supermarkets and cheap imported foods, processed foods, which are, people buy cheap foods just to put food on the table. But the issue is that often these foods are not nutritious. So what you see is that often, despite you have, in some senses, this double burden of malnutrition, as it's called, where children might be too short, but they might also be overweight. And I think this exposure to these new food systems are also going to be a key factor. So I've mentioned climate change before, which really affects rural areas directly, but also the economy as a whole. But also the fact that urbanization brings people into a different food environment where people consume these processed foods, leading to potential obesity. So we have these double-edged problems. So with climate change, on the one hand, one really needs to think innovatively, because it's not necessarily the case that we're going to reverse climate change in a very easy way. Our region is particularly vulnerable to climate change. So one would have to think of alternative ways of farming to improve technology such as drought-resistant seeds, such as finding a way of using irrigation in innovative ways. But on the other side, on the urban side, it's far more about consumer education and also finding ways to make more healthy foods affordable. One way in which South Africa does this is especially through schools, and where school feeding programs give children at least a meal a day, and ensuring that these foods have the right diet mix so that children can remain healthy. Of course, children only go to school from the age of about 5 or 6, which means that in the critical period when children are very young, in the first 1,000 days of life, which starts from conception to 3 years, to 2 years, is essentially a critical period which schools cannot capture, and which means that really focusing on things like early childhood development and also helping mothers to understand that critical period of nutrition, which lays the basis for later nutrition, is also very important. So I would say this is a very multi-pronged approach on solving food security. It's not just about growing more food. It's also about, I'd say, consumer education being very important, and also helping mothers to really assist in that critical window in very, very early life.
What about those living in rural communities? I mean, this also affects those in rural communities where one would assume that they have access to land which would ensure that they do grow their own food.
Yes, I think in rural communities you have these options of growing food. We know that food gardens are very important in South Africa for food security. So it's often both in urban and rural areas. So what often happens is people don't farm on very large pieces of land. It's very small pieces of land, and this assists individuals to be able to basically improve their food basket and their food situation. The one thing that has been very important in rural areas in South Africa in particularly is access to social grants. If you look at the trends in social grants and the trends in hunger, particularly in the former homelands areas in South Africa, these things really move together. The fact that social grants really help households to then also buy food. So we shouldn't just think of subsistence farming and the land as being important. There's also this ability to be able to buy food on the market, which is very important for hunger. So during the COVID-19 crisis, cash transfers and social grants were also very important in alleviating this kind of hunger. We know, for instance, in the COVID crisis is that hunger particularly rose much more in rural areas compared to urban areas. And joblessness is at the core. But when jobs are scarce, then land does become important, and it's kind of like a backup option. But we shouldn't forget that accessing food on the market remains a really important source of food. The real problem is in rural areas is that people spend very large proportions of their budgets on food. And this is generally a sign of food insecurity, because it means that if they spend lots of their money on food, they don't have enough movement to spend on other important things which they might need. It really signifies, in some senses, an economic crisis inside the household. So it's about being able to say how are those budgets extended. And farming on small plots of land is important to fill that gap. But of course, as we know, in the 2015-16 drought, this was put under severe pressure, especially in places like KwaZulu-Natal, and this then affects hunger quite dramatically. In those cases, social grants have helped, and again, it's this mixture of factors which are important. When the one factor fails, then the other factor must come in to help individuals.
Absolutely.
But yes, you're quite right. Rural areas are particularly vulnerable in terms of just having enough food.
Now, as you make mention of the food basket, I think it's also quite significant and important to equate the ratio of the food basket versus the national minimum wage. The food basket is a lot higher.
Yes, and this is alarming, right? So you mentioned the figures that more than half or approximately half of workers in South Africa don't earn the national minimum wage. And then if you consider that the high rates of unemployment and the number of people who don't earn wages at all. And what this means is that the role of social assistance is very important in a country like South Africa. I mentioned the high levels of inequality as being one of the factors that are very important in determining food security in South Africa. And this is exactly displayed in the statistics that you mentioned. The fact that the food basket is not, the national minimum wage is not enough for the food basket, which really means that other social support, is very important. And this is why we think about social grants as being as important as they are for food security. I think a lot of households rely on social grants to achieve their food needs. The other coping strategies is to have a food basket that is not as nutritious as it should be. To buy cheaper foods than is necessary or than is required. And cheaper foods are often less nutritious, which automatically means that there's this long-run risk for acute malnutrition. And I think this is partially why we have such a high malnutrition rate in South Africa, where about 1 in 3 of our children are shorter than 2 standard deviations of the international benchmarks, so stunted. And this is partially a result of these high levels of these budgets that are really under strain. So this is why the debate is going forward and talking about basic income grants and where the debate currently is at and where our government is thinking about supporting households with basic income grants. But I also mentioned school feeding programs as being a very important component of this. We are fortunate in South Africa that school feeding programs are quite widespread. But as you recall, during the height of the COVID-19 crisis, when many students or children were not going to school, they weren't receiving these meals. So this is also an important component. When households cannot feed their children, then we need the support inside schools. So I would say, just to sum up, there's a few things that need to happen. Is access to jobs is very important for the future, so that households, and access to good jobs, so that households actually can afford food baskets. So minimum wages might be a factor, but enforcing those minimum wages so that households actually achieve these levels, standards of living, is very important. But then social support in terms of cash grants is not going to go away very soon. This is going to be with us in the long run, and it's going to be an important tool to help households achieve food security.
Absolutely. Thank you so much for that, Associate Professor of Economics at Stellenbosch University, Professor Dieter Von Fintel, speaking there about a very complex situation as we observe World Food Day, observed, of course, on the 16th of October each year, highlighting the plight of 870 million undernourished people in the world. Quite shocking as we think of those numbers.